Have you been told you've got degenerative disc disease, but you're not quite sure what it is or what it means? Well, this video is for you. What's up guys, Dr. Carver back with a quick video. Today we're talking about degenerative disc disease. It's a very common condition. In fact, most of us will probably get it because it is essentially wear and tear of our discs. Now, what determines how bad you may get it depends on a lot of factors like repetitive stresses or injuries, your weight, postural distortions, how rough you are on your body. So keeping good spinal health is important to help keep this process in check. So I thought I'd show you what your spine looks like from a normal spine all the way to severe degeneration. Now to do that, we're going to break out some of our models. The first one I want to show you is a healthy segment. There are a few landmarks you want to pay attention to, and these are going to help us assess how much degeneration has happened. All right, so in a normal segment, a couple of things we want to pay attention to. The first thing we look at is the disc itself. Now on a disc, you want to make sure that it's about a third of the size of the vertebrae. That tells us that it's very well hydrated and it's capable of holding the weight of the body. Now a disc is two parts. There's this outer ring right here called the annulus. This is a very tough and fibrous structure, and what it does is it holds this inner part in. This is called the nucleus pulposus. This is the part of the disc that does the bulging or herniations. All right, another structure we want to pay attention to are the spinal nerves, and you want to make sure that there's no bulging or no bony spurs poking in at these. Nerves do not like to be poked. Another structure we want to pay attention to is the spinal cord, and really the housing of the spinal cord that these segments make. We want to make sure that it's nice and thick and a lot of breathing room for that cord in there. Another thing we want to pay attention to are the bones themselves. We want to make sure they're nice and smooth and there's no bony spurring happening. Okay, so phase one of degeneration. What we're going to start seeing here is some very subtle changes. In most cases, these patients don't have any pain at all, so this one's a really tricky one to catch. But a couple of things you want to look out for. The first thing you want to see is this disc does begin to narrow a little bit. It's not super narrow, but enough to take note of. Sometimes that can cause some very mild bulging in there, sometimes not at all. Now, when we look at the disc, these two parts again, this annulus you're going to see start to wither, so you're going to start to see it kind of delaminate a little bit here. And what will happen is as the pressure compounds down that spine, you're going to see that nucleus become inflamed. All right, a couple other things we want to look at here in this phase. Again, the nerves, they still look pretty well maintained here. You're not going to see too much nerve impingement here. Also, the cord itself is still looking pretty good. It's nice and movable in there, so we're not going to worry too much about that. And you're not going to see any bony spurring typically in this phase. So typically very healthy patients, but just the beginnings of degeneration starting to form in here. And again, sometimes no pain at all in this phase. All right, so phase two of degeneration, here's what we're looking at. Again, we're gonna start with the disc. We're gonna see some pretty significant narrowing here. Now, this can just wither away or it can bulge out. So we see a couple examples of that. Here's what a bulge would look like. You're gonna start to see that impinge on this nerve. And on this top disc right here is where it's just withering. You're not really seeing any bulging, but it's gonna compact enough to put that impingement on the nerve by the bones themselves. Now, patients here are going to notice a good bit of pain, but it's not really going to be constant pain, but enough pain to make them want to do something about it. So this is typically the stage that we see most of our patients. All right, so a couple of things again. You're going to see this pressure on the nerve begin to wither that nerve a little bit. You're going to start to see a lot of motor function loss. Lots of pain, radiating symptoms can be possible with this as well. Again, the cord, it is still movable in there, but you're starting to see a narrowing of that space. And again, this is basically one big nerve, and nerves do not like to be poked. This is called spinal stenosis when this gets really bad. All right, the last thing we want to look at is we want to see the bones. We're starting to see some spurring happening here. So these are called osteophytes, and this is just bony growth as your body tries to deal with an instability. So it's growing that new bone in there. This is just good old arthritis. Typically, patients aren't going to notice much pain from this, but it is a really good indicator of how long the problem's been there. These bony growths take quite a while to happen. This tells us that this patient here has been degenerating for quite a while. And obviously, the longer something degenerates, the harder it is to kind of manage it. So that's phase two. So moving on to phase three. Now in phase three, you're going to see a lot of significant degeneration. We're going to see a lot of decreased space of this disc. It almost can look like bone on an x-ray a lot of time. Typically there is going to be some material there, but not a whole lot. What that's going to do is it's going to cause a lot of impingement on the nerves and the spinal cord. And again, nerves don't like to be poked, so this is going to cause that radiating, numbness and tingling, spinal stenosis, motor function loss, things like that, a lot of dysfunction. The last thing you want to see here is you're going to see a lot of bony spurring. So these bony spurs, again, it's your body's way of stabilizing an unstable joint. Now, in this case, you're going to see some inflammation and irritation because of this. A lot of times these spurs can poke in on these nerves and cause a lot of damage. Just really, really nasty symptoms here. And these patients are typically in pretty constant pain. All right, so Those are the stages of degenerative disc disease. Now in our office, we're going to do a thorough assessment to see where you are in this process and develop some recommendations and strategies on how to manage it. So if this sounds like you, go see your chiropractor. Let them do a thorough exam to see where you are and what can be done. So that's it for today. Don't forget to give us a like, a thumbs up, let us know you're out there, and have a fantastic day.